Out, tens of thousands of Americans live with pain and often seek solutions through surgeries and medications. Instead, I believe that better use of chiropractics and pain medicine techniques could lower those costs at high-cost interventions while still helping patients get pain relief. But they can't because of Medicare's antiquated payment systems. Dr. Hoban is the Chief Medical Officer of Population Health Services for a health system. What are the multidisciplinary strategies and interventions your organization pursues to treat chronic pain?
Thank you for the question. We use, as you described, a multidisciplinary approach. So when you involve care teams between neurologists, anesthesiologists, surgeons, physical therapy, chiropractic care, pharmacy team, it is a collaborative effort to care for a complex disease state like chronic pain, because it involves more than just the physical aspect. There's also the psychological aspect and the social aspect to that complex condition.
And how do chiropractors fit into that plan?
We see chiropractors as part of the care team. So as we think about the modalities that they are skilled in and trained in and have access to, they can integrate into that care team appropriately where it fits in for those modalities.
Dr. Parikh, am I pronouncing that correctly? What recommendations would you suggest to our committees to address telehealth resources to rural and lower income individuals?
I think the first thing is to make the pandemic era expansion permanent, right? We need to be sure that we can use telemedicine as an access point, like we've all talked about, to enhance care needed for our patients, particularly in rural areas where there is a scarcity of providers. I think it can offer an alternative for all the things that I mentioned, for acute illness, for chronic condition management, and then for prevention of exacerbations that lead to hospitalizations. We were just talking that there are areas where there isn't a hospital in a 100-mile radius. For those folks, if we can catch that heart failure early with remote patient monitoring and adjust those medications with telemedicine and a consultation with a pharmacist, then you've saved that patient's life in addition to significant cost savings.
And senior citizens, and I have a lot of them in my district, often have challenges with tech devices and iPads and all that sort of thing. So what can we do to utilize telehealth easier for senior citizens?
One is to make it built into the electronic record and easily sending the link so that there's a one-click way for them to access it through their computer or their phone. The other is to allow for audio-only telemedicine visits, right? Almost every senior can use a phone, and we have found that there are many times that you can get equally good care through telemedicine with audio only. And then the last is non-synchronous care, right? Where they can send you a message, leave you a message, you can answer it not in real time, but in a timely way that you can give them the care that they need.
In the remaining time I have left, Ms. Reichert, from your experience in providing rural communities with better access to health care, what are the most successful techniques you found to reach those individuals who may not have access or resources?
Yes, thank you for this question. I think for pharmacists, a lot like myself, other pharmacists like myself, the best technique is our frequency of interaction with our patients. I lay eyes on my patients. I see a lot of my patients on a weekly basis. And I think that sets pharmacists apart. We have that frequency of interaction where we're able to reinforce adherence, prevent complications, and coordinate with their physicians when needed.
Thank you. I yield back.